There are many options for birth control available, so choosing the right one can be difficult. Today we'll be talking about everything you need to know about choosing the right birth control option for you. So hit those like and subscribe buttons and stay with us. When choosing birth control, it's important to consider your personal preferences and needs. You need to take into consideration your health and medical conditions. Certain birth controls may not be an option depending on what your medical background is. Future fertility desires when you plan on starting your family is a big deciding factor. Also, how many partners do you have and how often are you having sex? And finally, you want to look at the safety and efficacy, how effective these birth control methods are and whether they prevent sexually transmitted diseases. There are some natural and non-hormonal methods that you can consider when choosing birth control. Now, these methods are reversible, but they're less effective than hormonal options. The first one is abstinence. This is where you don't have sex. It's 100% effective, but it's difficult to maintain. The next one is fertility awareness. This is 74% effective depending on how you use it, and this is based off of typical use where people kind of sometimes do it right and sometimes they don't. Standard days method is 76 to 83% effective. This requires somebody to track their fertile days. The withdrawal method or pull-out method is only 78% effective. This is because the pre-ejaculate, sometimes referred to as pre-cum, actually can still have sperm in it, which can cause pregnancy. There's also something called outer course. This is where there's no vaginal penetration. It's nearly 100% effective, but it's challenging to actually maintain. Then finally, we have breastfeeding. Breastfeeding can be used as birth control. It's 92 to 98% effective, but there's a couple things. You have to do it exactly as it's designed, which requires frequent breastfeeding. It's only available up to 6 months, and fertility can return unexpectedly, which means you can ovulate without knowing. Traditionally, the most commonly used birth control method are hormonal methods. There's many different types, including pills, patches, injections, vaginal rings, and IUDs. Their effectiveness is anywhere from 91 to 99% with typical use. Side effects can include weight gain, mood changes, blood clot risks, and acne. The blood clot risks are especially concerning with certain health conditions. Understand that hormonal birth control methods do not protect against sexually transmitted diseases, so you need to use a condom with them. Please remember to hit the like and subscribe button so you can get our latest content. There are options for birth control that include barrier options or permanent birth control. So barrier options include condoms. There are both male condoms and female condoms, and these have 82 to 98% effectiveness for pregnancy prevention and some sexually transmitted diseases. There are also diaphragms, cervical caps, sponges, and spermicide. Now, these are all items that are inserted into the vagina. They have varying effectiveness from 72 to 91%, but they do have some side effects like potential irritation or increasing your risk of a urinary tract infection. When we talk about permanent birth control, there are two options. For women, there's a tubal ligation, which is over 99% effective. This is where they either cut and remove or burn the fallopian tubes. And then for men, there is a vasectomy, which is also 99% effective. However, this does require some pre-operative testing and follow-up tests to make sure that it actually worked. There are a few options for emergency contraception or emergency birth control. The first one that's most often used and most often known is the morning after pill, also called Plan B. This is 97 to 99% effective if taken within 72 hours of unprotected sex. The other option is a copper IUD. This can be inserted as emergency contraception, and is highly effective if inserted into the uterus within 5 days after sex. I hope this video has helped you learn everything you need to know about choosing the right birth control option for you. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe button so you can get our latest content in pregnancy, labor, and early childhood parenting. Share this video with your friends and family and follow us on Facebook and Instagram for additional content. We will link those into the description below. Thank you so much for joining us at the Maternity Mentor.